Hello. Welcome everyone, and welcome Ioana to the Centre for Social Impact Research Seminar Series. And I'd like to begin by acknowledging that we here at UWA are on Whadjuk Noongar land and pay our respects to elders and to all Aboriginal people in what we do. So we're very glad to have Dr. Ioana Evers here to present this seminar. It's a seminar on social marketing for social good, and will examine 50 years of scholarship around that topic. And of course, it's a topic that we are recognizing more and more needs to be a fundamental part of the social impact agenda. So really glad to have you here, Ioana. Ioana is a senior lecturer in the UWA Business School here at UWA. Her research interests centre on sustainable and conscious consumption, social marketing and behaviour change, personal values, pro-social behaviour, including charitable giving, and cross-cultural psychology. So very glad to have you, Ioana. Now, we'll have the presentation over the next 45 minutes or so. You can always add in questions into chat or make comments into chat. At the end of the 45 minutes, when Ioana is finished, what we'll do is open it up to the audience, and we'll run through any questions at that time. This is being recorded. This webinar is being recorded and will be on the UWA website along with the PowerPoint slides at some point. So welcome, Ioana.
Thank you so much for that lovely introduction. I'll share my slides and see if you can all see them. Thumbs up. All right, I see some thumbs up, so that's amazing. So thank you all for making time to come to this webinar, and thanks for the invitation to present today at the Centre for Social Impact. So I'm Ioana Evers, and my research focuses on particularly personal values and in contexts like sustainable consumption and social impact. And so what that means in practice is that I spend a lot of time thinking about why people don't always act in the ways that they say they want to. You know, they say they care about this, but they don't always act in that same way. And that question is very much at the heart of social marketing. So I know it's already been acknowledged, but I would also like to acknowledge that I'm in the business school right now. I'm situated on Whadjuk Noongar Budja, and that Noongar people remain the spiritual and cultural custodians of this land. I want to pay my respects to all members of Aboriginal communities and to elders both past and present, and I would love to extend that respect to all Aboriginal people here at the session today. So let's dive straight in. You know, we have so much access to data and extraordinary behavioural insight in the past decades, huge advances in behavioural science, neuroscience, data analytics, and they've dramatically improved our understanding of how people make their decisions. Yet across probably every domain, including health, sustainability, we see a persistent gap that remains between what people intend to do or what they would say they like to do and what they actually do. So no doubt you've all heard of this intention behaviour gap. It's definitely not new, but it is definitely persistent. So in response, social marketing has developed over the past 5 decades as a discipline to explicitly focus on closing that gap. So I know many of you do know what social marketing is, but just in case some of you don't, I'd love to talk you through a little bit about what social marketing is. And at its core, it's defined by its focus on behaviour change. So a widely accepted definition by Andreessen is it's the application of marketing principles and techniques to influence target audience behaviours, and crucially, that benefits society. So we've got benchmark criteria here that you can see in the little flower. Firstly, Andreessen proposed 6 benchmark criteria: behaviour change at the core, but social audience research, segmentation, the exchange concept, competition and marketing mix as 6 initial benchmarks. And that was later expanded to include theory and then customer insight. And what the evidence says so far is that these benchmarks are directly associated with intervention quality. So when we incorporate, ideally, all of these in how we deliver our programs or initiatives, the evidence suggests that the more we include them and we include them in a genuine way, that relates to better outcomes, sustained behaviour change. Although I will preface that with, the evidence that we do have from a lot of studies is often correlational and not causal, and methods do vary across studies, but generally as a trend, that is true. The more we use these benchmark criteria, the better outcomes we see. I do want to also just say what social marketing is not, because it often gets confused with other things, and especially social media marketing. Anyone here who is a social marketer or who says that they research or engage in social marketing has definitely had the person they're talking to say, oh, yeah, social media. I know what you're talking about. It is absolutely not that. So it's really tricky because it sounds similar to social media marketing. Social marketing initiatives may have a social media component, but generally what we're talking about is behaviour change and for a social good. In that way, some corporate social responsibility might be confused, or public awareness campaigns. They're not the same thing. So of course, in a public awareness campaign, if it's not about behaviour change or not addressing the benchmark criteria, then it wouldn't be classified as social marketing. So we often get confused with a few other fields. So I'd like to kind of have an example to kind of bring social marketing to life for you. And so before I'll introduce the example of cycling as transport, and I want to go through then what aspects of social marketing are distinct to social marketing and what makes it at its core. So cycling as transport might seem really simple and everyone has an opinion about it. Many cities have tried to promote this behaviour, and often those efforts have not always worked as well as they aimed for. So the next few minutes, I'm going to try and show you that when you apply social marketing's core principles like rigorously, you end up somewhere quite different than from a simple cycling campaign where you're like, oh, telling everyone the benefits of cycling. You end up with a diagnosis across systems, and this is the point. So let's begin with the basics. What would the actual goal be in a social marketing campaign to encourage cycling as transport? Well, the first and most defining criteria is very simple. Social marketing is about behaviour change, not just awareness or shifting attitudes or recalling messages. Andreassen's benchmark criteria for social marketing is really clear on this, that behaviour has to be the target and everything else really is a means to that end. So let's say we surveyed, most urban non-cyclists, and probably a large proportion of them would say, oh yeah, I know cycling's, good for my health, good for the environment. So awareness isn't the problem. And even attitudes might not be the problem either. Maybe some non-cyclists also say, oh yeah, I'd like to cycle more. The attitude's there, the awareness is there. But if we understand, this understanding does change everything. We stop starting from the awareness or attitude change, and then we start trying to think about, rather than communicating the benefits of cycling, we might want to say what specifically stops a person from getting on a bike to go to work, and also what would remove that barrier for them. So the second criterion that is distinctive to social marketing is this audience insight, and it really has to come before designing a message, before we select our channels, before anything else. And here's where cycling is an interesting example, because it can expose how badly campaigns can go if we treat our audience as just all the same. Non-cyclists are not all the same. So any type of people we're trying to target, they have differences and they're important differences. And if we're conducting formative research, qualitative or deep observational work, it will reveal different barrier profiles across segments. So let's, as an example, consider a few different kinds of people that might want to but don't currently cycle to work. So you might have a middle-aged professional who would, generally like to cycle, but they get hot and sweaty. So when they get to their office, there's just nowhere for them to change. So for them, it's not motivation that's a barrier. It's an infrastructure or end of trip facilities barrier. And a campaign telling them to cycle won't change until they have something to address the barrier. They have somewhere to change at the end of their trip. or like a mum with kids who's doing the school run. If there are no bike paths or no safe way to travel by bike to school, again, there's no amount of like motivational messaging that would change that mum's behavior, because she can't get the kids on a bike and safely to school without the right infrastructure. So then it's the absence of the cycling paths or a safe way that make it not viable for that person. Or, let's say, a young man who lives in the outer suburbs, maybe in a low income area, he might want to cycle, but if he lives in an area where there's like high bike theft and good bikes cost a lot of money, maybe he's not in a position to like replace a bike every time it gets stolen. And so then his barrier is more about having somewhere secure to store his bike so it wouldn't get, taken from him. So this insight principle tells us an intervention for each of these people is fundamentally different. The message is different. The barrier is different. If we skip insight, then we might end up designing something that doesn't fit anyone particularly well because we don't understand the barriers properly. So exchange theory sits at the heart of social marketing, and cycling really demands that we get this right as a behaviour. So what exchange is quite straightforward. People will adopt a behaviour if, that benefits or perceived benefits outweigh the costs. And as a social marketer, it's our job to understand that equation honestly, and not just from what we assume or think, but from the audience's perspective, and then try to shift it. If the costs are outweighing the benefits, how do we shift that to make the benefits outweigh the costs, or how do we reduce the costs? So what does cycling ask of someone who currently drives to work? Cycling would ask them to exert some physical effort and potentially arrive sweaty. It asks them to be exposed to the weather. It asks them to share a road with vehicles going really fast right next to them. It asks that it takes away the privacy and comfort of a car. It reduces their capacity to carry things, and maybe even in some professional contexts, it would be deemed like unprofessional, or it has a status cost that might matter to some people. So in exchange, what we think about and what we're offering, for cycling, we would say, improved health outcomes, maybe financial savings, you would have a reduction on your environmental footprint. So these are some of the benefits, but as we can see, there's quite a lot of costs. So if we honestly do an exchange analysis, currently for many people and in different contexts, it's not a favourable trade. And so social marketers strive to offer a valuable exchange for the target audiences that they want to change their behaviour. And then finally, competition. This is the fourth critical distinction in social marketing. And it's not even just enough to acknowledge what the competition is, but to try to actively design understanding what the competing behaviours are. And so for a social marketer who advocates cycling as a transport, you're competing with the car industry, who's had a lot of time shaping infrastructure and what our cities look like. Cities are, designed for cars and for speed. Maybe even employer cultures where cycling might seem a bit eccentric or not so professional, but also might not have the facilities for when someone arrives at work to comfortably change and be ready for work. But also we're competing against that sheer convenience of being in a private car, door to door, doesn't matter the weather, carry what you need to carry. So that is a big competition. And this is the point in the analysis where we start to see that it's a more structural issue. It's not just the person's behaviour, it's a lot of competing forces that are bigger than the person. So a campaign targeted at an individual, no matter how well we design it or how well we target it, can kind of compete with those amounts of competition. So it just means that when we think about exchange and competition, as social marketers, we start thinking about the broader picture. And that's what the scholarship and the literature is telling us. There has implications for where social change organisations or people who want to make impact maybe direct their resources and advocacy. Because if you're only doing it at the individual level, it might not be enough. You need to start thinking broadly and get the right people involved over time. So I guess we started with what sounded like, a simple social marketing challenge, get more people to cycle to work. But when you start really going through that challenge with the social marketing framework, you might just only end up with a campaign if you don't consider all of these things. You might, create some inspiring content about the benefits of cycling, pop it on social media and some billboards. And you might even say, oh, we reached heaps of people and people's attitude shifted. And you think, oh, it's pretty successful. But if you didn't change like too much about it, and if you don't also measure the actual behavior change, you might not really see that you made much impact at all. But if we start applying these benchmark criteria rigorously, including, the behavior change, insight, exchange, competition, we're going to arrive somewhere quite different than an individual behavior change campaign. We might start to talk with employers about having the right facilities in the offices. We might start to talk with governments about having the right bike paths and ways of people traveling safely on a bike. We might have then subsidized or secure storage for bikes, but also subsidies for e-bikes if people just don't want to or cannot expend the effort required on a bike. So it becomes like way bigger than what I think where social marketing began was very individual focused. And now over this 5 decades, we're seeing this big kind of shift toward the important lesson is, it's not that people don't care enough or they don't know enough. It's that we need to consider the competition and the forces working against the desired behavior. But we need to, design the right exchange in the right environment for that right segment that we define. So it's getting we're zooming out a bit more. That's where it feels like the social marketing literature is heading. Okay, so one case study, which I'm sure you're all aware of, is Slip, Slop, Slap campaign. So it's a really good example of a successful social marketing campaign over time. It wasn't just a slogan like slip, slop, slap, but it was long-term behavior change. And it worked because I had a very clear behavioral goal, like it's in the slogan. People knew what they had to do. And the exchange was very strong because, it was, I guess, minor inconveniences versus getting skin cancer. But what was really crucially important and why it's been successful over a period of time is because it actively changed social norms around tanning and being in the sun. So over time, and that is crucial, wearing hats or using sunscreen absolutely has become the norm, and it's not the exception. And even it was multifaceted, so in schools, no hat, no play, it really became a cultural level change. So again, the behavior change happened at the individual level, but because at a cultural level. So it's these kind of campaigns we can start to think about why they were so successful. So if we zoom out on all the evidence over 50 years, that evidence is getting substantial. It's international now, and it's broadly positive, with the caveats that often it's correlational and we need to talk about sometimes how we measure things. But basically, the most comprehensive systematic review of social marketing, for global health, it was over 120 studies. Programs with positive, statistically significant findings were way more likely to include all of the benchmark criteria, and especially audience insight and a strong cost-benefit analysis or exchange that led to behavior change. And social marketing historically is focused, I guess, predominantly on health-related behavior, like tobacco cessation or physical activity promotion. But more and more in recent years, the focus is on broader social issues like the environment, safety, and equality. And I think, what it looks like, this expansion is really significant because social marketing's toolkit is now being applied to big issues like the wicked problems, climate action, sustainable consumption, financial well-being, species conservation, domestic violence. We're not just applying it to public health, and we're not just applying it in small ways. We're trying to address big problems. But as I mentioned, we do have to acknowledge the limits of the evidence that we have so far on social marketing. And often it's a measurement problem because sometimes studies will just report short-term outcomes or self-report, maybe even just awareness or knowledge and intention rather than actual behavior. But the way I see it, that's not a reason to abandon social marketing, but it is a reason to be really rigorous with how we design interventions, that we design for evaluation from the beginning. We think about how we want to test that behavior change before, during, after, and sustained into the future. Because our interventions and programs and initiatives, particularly when they are longer term, are a big investment in behavior change. And as I mentioned, the discipline is not just now trying to achieve behaviour change, but maintaining that change over time. So I guess in the beginning or earlier in social marketing scholarship, it was about how do we change behaviour? We know a lot about that now, but how do we then work with all the systems and work for maintenance of behaviour change over time? So traditional approaches of social marketing, so in the earlier decades, there was a risk where we're placing a lot of responsibility on the individual, but for problems that were probably structural issues. So we can't blame an individual for also the systems that they live in. So one of the most important shifts in social marketing, moving the focus away from only the individual to a focus on all the broader systems. So, you know, rather than how do we change the person or their behaviour, how do we change that environment in which the person makes their decisions? So the image there is of Bronfenbrenner's ecological systems theory. And I think it's a really nice way of looking at or thinking about the systems that exist around us all. None of us exist in a vacuum. And we know from research, our behaviour depends heavily on our environment. And that includes the people and the systems that surround us. So I'm sure many of you have heard of this like river analogy and using the words, you know, upstream, downstream. I just want to make that really clear for anyone that hasn't heard that before. So there's an old river analogy examining 3 levels: upstream, midstream, downstream. And in this kind of classic public health tale, a witness sees someone fall into the stream downstream. And they quickly jump in to save that person. And then there's a few more people drowning in downstream. So they're trying to rescue all these people. And after a while, they go, okay, why are people falling in upstream? Like, what's happening upstream that's causing all these people to be drowning down here? And so the fable is to think about, okay, we can look at the individual or we can look downstream, but maybe that's not telling us the cause of the issue. So if we look further upstream and work at different levels, we might be able to address issues more fully. And so again, in social marketing over the decades, there's a shift toward having a multi-level perspective. And so that is not to abandon the downstream. We do need to look at individuals' behaviour, but acknowledge and build into the design of interventions that exists also in communities and organisations or social networks, which would be like midstream, and also what the environment is like in terms of regulation and policy and culture upstream levels. And so, you know, historically, if we were only focusing on downstream kind of interventions at the individual, scholars increasingly began to argue that that was insufficient for addressing complex social problems. Upstream social marketing targets decision makers, institutions, and it recognised that behaviour is shaped often by structural conditions. And so this shift over time is aligning with broader models of behaviour which emphasise interactions at different levels of influence. We're starting to recognise that, you know, these big social issues or wicked problems are characterised by just its complexity and interdependence. And so about 10 years ago, the concept of like macro social marketing came in, where we start to extend our field's scope to include, you know, broader norms and policy and networks. This is still emergent, so we don't have all that much maybe empirical work on this, because it's like the concept was only kind of 10 years ago, bringing it more macro, but we're working toward that at the moment. So another case study, again, something that's been really effective, and I would argue because it addresses all the different parts of the stream at different levels of systems, the tobacco control program in Australia. So it's a national public health initiatives led by the Australian government to reduce tobacco-related harm. So it coordinates as a broad initiative research, policy, community interventions that target not only prevention, but cessation and protection from secondhand smoke. And it forms like a big framework to address tobacco in Australia. And what we can see is that sustained behaviour change is most likely when interventions operate across multiple levels simultaneously over a period of time. So you can see here, I don't expect you to be able to see all that text on the screen, but from the 1970s, that's when this initiative, so it's been over 50 years, and the evidence is really strong that this is really effective. So tobacco control provides a clear example in Australia where there was, you know, downstream or individual quit campaigns and cessation support at that level. Midstream, it addressed community norms around being smoke-free, but importantly also upstream, there was regulatory policies, plain packaging, legislation and taxes, and all together sustained over time, it's effective. Part of the intervention or program is also tracking it, so collecting data and evaluating it over time. So there's ongoing surveillance of smoking trends, it evaluates policy outcomes, and it, of course, supports evidence-based intervention, makes tweaks as they go along. So from the early 2000s, I think the data says it was over 20% of people that smoked, and now it's around 10%. So it's halved the number of people who smoke in Australia in that time. And I think in this way, Australia is viewed as a global leader in tobacco control because of these kind of multi-level initiatives. So downstream only approaches, when I say that just only based on the individual's behaviour, often fail. And we can see that in the scholarship clearly over time. So let's say healthy eating as an example. If we ask individuals to make better or more healthy choices in an environment that's absolutely saturated with cheap, supermarketed or heavily marketed, ultra-processed food, it's no wonder that people are not able to make that change so easily. Unhealthy junk foods are really strongly advertised and they're not really subject to strong regulation. So all of that undermines any sort of behaviour change campaigns to encourage eating, fresh fruit and vegetables or eating healthy foods. So at some point we do have to acknowledge we can't expect people to make choices that are actually really inconvenient or expensive or outside social norms. And that's part of what social marketers have to constantly think about. How do we make the desired behaviours convenient, more affordable, or even cheaper than the alternatives, and over time change the norms that everyone's acting in the way that we hope. And so I guess the reality is that commercial interests do impact our health. And so there is this concept of the commercial determinants of health, which highlights how corporate practices influence health outcomes. And that's not a new idea. Obviously, that's really obvious to probably everyone on this call. Large industries, and often led by the marketers in those organizations, they actively shape, what products are available, what's affordable to people, and over time, what's normal. And sometimes, and maybe even often, the incentives from the commercial world run directly counter to public health goals. And of course, that creates a really challenging context for social marketing behaviour change. Okay, so I thought midway through the presentation, I'll just address some common questions you might have about social marketing, because I hear these questions come up a lot. So I thought if we just talk about them in the middle, they might address some of the things you're thinking about. Question 1, is there actually strong causal evidence that social marketing works? So I kind of already addressed this a little bit before. While the evidence base is broadly positive, and we do have consistent findings of behaviour change across domains, especially in public health, we don't really have all that much causal data to say for sure the social marketing intervention was there and then it's directly attributed to that intervention. It's hard to control for everything else, right? So generally studies rely on quasi-experimental designs, only short-term outcomes, or only self-report data. So that's a measurement issue in our social marketing field. But I guess rather than asking does social marketing work or not, I think what we can see with the data over time is that we're learning under what conditions social marketing can work really well. And so the strongest evidence points to interventions that apply all the benchmark criteria and operate across levels are generally more successful or lead to sustained behaviour change, but we don't have all that much causal evidence. Number 2, isn't social marketing just behavioural science or public health? There are big overlaps, but social marketing does bring a distinct contribution, particularly in 3 areas which we've already spoken about. So the exchange concept is not in, I guess, behavioural science or explicitly in public health. So understanding that behaviour is a value trade-off. The competition factor, recognising that behaviours there are competing behaviours that are going often against what the desired behaviour is, but also bringing in the marketing mix and going beyond just like promotion or communication as a campaign to include product, what the behaviour is, price, what the costs are, and then a place, how to make that desired behaviour convenient or accessible to people. And so thinking like a marketer in that way brings something new or distinctive that is not part of behavioural science or public health. And yeah, going beyond that, social marketing integrates it, I guess, these things into a more applied intervention-focused framework. Number 3, how do we measure behaviour properly in this field? I guess, again, many people on this call would definitely acknowledge that measurement is a big challenge. Ideally, we want objective behavioural data. We want observed behaviour, administrative data, or longitudinal tracking. That would be like best practice. Generally, of course, due to cost and feasibility and all sorts of constraints, we often have self-report and often in short periods of time. The field looks like it is moving towards stronger methodological designs, including mixed methods like qualitative and quantitative, stretching out longer time horizons, and triangulating different data sources. But the field isn't there yet, but it feels like we are moving in the right direction in terms of that methodological rigor. So I guess in response to this kind of question, I think social marketers need to be transparent about what we can and can't claim from the data we have. One about co-creation. Is it really more effective or just kind of a trend? I'd say co-creation has strong theoretical support and growing empirical work suggesting that it does improve, relevance and uptake of behaviours when you co-create initiatives or interventions. Obviously, it's not a guarantee of effectiveness. If you co-create, it won't necessarily be more effective, and it does come with some trade-offs like cost and time and complexity. But what the evidence shows is it seems like it's a really valuable approach, especially in contexts where understanding like people's lived experience is critical, and a universal solution obviously doesn't make sense. So definitely when there's different segments or groups of people that you want to understand lived experience, which arguably is a lot of the time, then I think co-creation is very valuable and not just a trend. If upstream factors are so important, what can practitioners realistically do? So, of course, in many cases, practitioners don't have direct control over all of those upstream levers. Like as practitioners, you can't just like change policy or change culture quickly, but these things can change over time. So the first thing I think is if practitioners, okay, you can be realistic about what you can achieve with downstream interventions, acknowledging and understanding what constraints there are at other levels of the stream or at other aspects of the system. But even if you can't change those things directly, yeah, you can often have influence. And again, if these initiatives or programs are over time you can chip away at like, can you influence some policy? Can you influence infrastructure? Can you influence things over time? More and more, it feels like that is what part of social marketers have to consider, not just running a campaign, but how you can have influence over time at different levels of the system. And so how does social marketing deal with structural inequality? So I feel like this is where this kind of shift toward, systems thinking or working upstream is becoming more and more essential. If behaviour, is shaped by structural conditions, people's income, access to infrastructure or their environment, then focusing only on individual change risks even reinforcing inequality. So social marketers can contribute by making some of these constraints visible and start by making them visible. But as you go on, design interventions that either try to reduce barriers or work alongside policy change that can hopefully happen over time. But this is like one of the biggest questions. And I think it's really fair to say that structural inequality is a huge and ongoing challenge for social marketers. And it's not something that can be like, this is an ongoing thing that will hopefully change over time. Okay, from the literature, what might we say is the future of social marketing? So I've got 5 areas where I reckon this is where it's heading, or this is what we can start seeing emerging. They're not just kind of theoretical academic trends. They do have implications for how practitioners, today, how you might design interventions. So systems thinking, there's a growing recognition that, the problems that we're dealing with, those big, wicked problems, climate change, inequality, like we're talking about, obesity, they're complex, interconnected, and of course, there is no simple solution. It's not just changing behaviour of some individuals and that's it. So what it means is that when social marketers are thinking about how they design like initiatives, it's not that we just design in a linear way, intervention, change that behaviour, and we have our outcome. That's often unrealistic for these kinds of big problems. So we need to go a bit broader than that. We need to think about feedback loops or unintended consequences and interactions between different levels of the system and different actors. And so I guess as social marketers or people in social impact wanting to make change, we can start thinking about like what systems are producing this behaviour or these behaviours, and where might we leverage different parts for change. So secondly, we can talk about structured behavioural models. So there are so many of these, but frameworks like COM-B, so Susan Michie and her colleagues came up with this, and they kind of force a framework or some rigour that underlies an initiative. So COM-B, for example, tells us that behaviour is dependent on someone's capability, someone's opportunity, and their motivation. And again, it sounds really simple, like a lot of psychological theory, but it's not simple because it's showing us how behaviour is, but it also prevents us from maybe going too shallow. If we have this framework, we really have to talk about, it's not enough to say that someone isn't changing their behaviour because they don't care or something, or they're not aware of something. It's like, do they have the capability to change their behaviour? Do they have the opportunity to take on the desired behaviour? Or is motivation a real barrier? And so if we're misdiagnosing at this level, that can often be the problem with interventions. But there's a lot of behavioural models we can look at and choose from according to the issue we're trying to tackle. So we've talked a little bit about co-creation already, but there is a clear shift of designing, moving away from designing for people and moving toward designing with people. And so the evidence suggests when people are involved in shaping interventions, it does reflect real constraints that they have. It can build trust with communities, and it can increase adoption of the behaviours that we're going for. But of course, co-creation for initiatives could be slower or messier, or you're in less control, right? You're trying to take on the ideas of lots of different people. But it might be way more effective. So if we try, we might be trading efficiency for effectiveness. And as I mentioned before, particularly when lived experience is crucial to understand, then the future, I think, does involve more co-creation of programs and initiatives. So fourth, digital technologies, digital tools give us capabilities that, of course, did not exist before. The way we can even just analyze all sorts of data, but we have real-time feedback. We can have interventions that are adaptive because we have data coming in and we can adapt over, quicker than before. We can be really precise in how we segment and target audiences. But of course, we always have this tendency to maybe overestimate what technology can do. So it goes back to, putting our thinking hats on and doing a really good job about what is the value proposition. Digital tools cannot, if we have a weak value proposition, it can't fix that. If we don't have good audience insight, it doesn't fix it, but it might be able to help us to get insight. Digital technologies also don't remove competition, but sometimes they can even intensify the competition. But having these tools means we can do so much more than we did before. And of course, technology is only evolving, ever evolving, and it's getting more and more advanced all the time. So this future of social marketing definitely involves utilizing all of the tools that we can have in our toolkit. And finally, there are alignment with global systems like Sustainable Development Goals. Social marketing is being positioned as part of that larger social change architecture, And that means that social marketers will engage with policy, governance, broader systems, and collaborate with various stakeholders. And really, I think what this looks like going into the future is really a shift in ambition. I mean, historically, especially when it was like individual focus, we would be talking about, very much a campaign level. But now it feels like we are being more ambitious because we have more technology and we have more information and more research and we have a better understanding. We can start to try to contribute to system level change and aim bigger. And so if we look at all these together, I think these shifts kind of point in one direction. We're kind of moving from being only, communications discipline and doing kind of individual level campaigns to a systems discipline and having a broader focus. Okay, going to go through these next slides quickly because I can see that we are running out of time, but I do want to make it a bit practical because I know many people on this call are practitioners or people in the business of social impact. So let's have some things you can take away. So first, it sounds a bit obvious, but diagnose before you start designing and getting into campaigns. So the starting point should be, what specific behavior are we trying to change? Who exactly is our audience or are our audiences, and what are their real barriers? And that really does require proper formative research and not just us assuming things, because that is the basis and everything else we build on goes from there. We want to diagnose where the level is. So is it a downstream issue? Like sometimes it could be that people just literally don't have the knowledge or awareness, but less and less, I think this is the problem. So is it downstream, a midstream issue about like norms or communities, or is it upstream about policy or infrastructure? Like where does the problem sit? Those persistent problems we talked about, the big wicked problems, exist on all the levels. But I guess the critical point to take away is, if the primary barrier sits upstream, a downstream intervention will, almost always underperform. So we can ask ourselves, as we're building interventions or thinking about initiatives, like, are we working at the levels where change is actually possible? And again, as we're aiming higher, it needs to be over a period of time. We need to take exchange seriously because every behaviour involves a trade-off. People are always giving something up if they're going to change. Is it convenience, time, comfort, their identity? And maybe as social marketers or people in social change, we might underestimate these costs. So we don't design for what we think is valuable, but what our audience actually values. And so if the perceived benefits don't clearly outweigh the costs, the behaviour just won't change no matter how good our campaign is. We need to understand the competition and what's competing for our audience's behaviour. As I mentioned before, we all don't operate in a vacuum. We all have to compete with like habits that are built over long periods of time, environments designed for convenience, and commercial industries with huge marketing budgets, often acting counter to what, our goals. So I guess, how do we compete with all that competition in the field? So we need to really understand and think about that in practice. And finally, as we keep coming back to, try to move beyond the isolated individual campaign and go big, go systems. How do different systems or elements interact, and how can we reinforce this behaviour change we're suggesting like over time? And this is not easy. It often means working, across sectors, engaging policymakers and building sustainable partnerships over time. And I think probably what this requires the most is patience, because I guess maybe in commercial marketing, you're in it for quick wins. You want to see like increasing profit or whatever. In this way, we're really in it for a long game. This is a marathon, not a sprint. So it does require patience. So if we're after system level change, it's slower. But the evidence shows if we operate in this way, that change is long lasting. Okay, so effective social marketing is about thinking in systems, thinking broadly, not just at individual level. So really quick, we can kind of put it in this way. It's not like an official framework or something, but if we think about like firstly diagnosing, then designing, then delivering, and embedding those benchmark criteria in there. So if we start with that custom orientation or the audience research and get our insight from there, and then segment carefully according to that behavior or the issue we're dealing with, then we design our initiative. We really, I've banged on about exchange and competition a lot, but they're very crucial at that stage. And that's where we can start bringing in different theories, including behavioural theories in the design. And in the delivery, we're really thinking marketing mix and methods mix as well, different channels. But in marketing, not just promotion, really thinking about product, price and place. And behaviour change has to be the core and the outcome that we measure. So I just want to close by returning to kind of where we started about the intention behaviour gap. We should understand behaviour better than we ever had. We have so much information, so much data, and awesome research. We have, lots of psychological understanding, really sophisticated behavioural frameworks, and more the technology and powerful data and ways of targeting. So the gap is not really our problem. The constraints are often like organizational. We have limited budgets, short time frames, structural barriers, like systems that incentivize the wrong behaviors, and maybe even political barriers where, what we'd like to see happen challenges existing interests. So maybe the barrier is like, how do we do the work we need at the scale required? So at its best, social marketing, we take behavior seriously, really in all its complexity, but we can't control everything. And we just have to understand that we work in a system and try and acknowledge what we can and can't change and work at what we can chip away at. So we have, as social marketers or people in social impact, the power to change behavior over time, but really contribute to kind of, meaningful and lasting social change. Very lastly, before we open it to discussion, I'd love to share with you, I'll take the opportunity to invite you to the upcoming Asia Pacific Social Marketing Conference held at the Business School, where I am currently and where maybe some of you are now too, this October. So we're going to bring together researchers, practitioners, policymakers, industry partners from around the whole region. We've already got submissions, not just from across Australia, but from New Zealand, Singapore, Malaysia, Indonesia. And we have a common interest in using marketing principles for the social good. We hope it's rigorous scholarship, applied insight, and we want to have a really constructive conversation about how social marketing can address some of the most pressing social and environmental challenges. We're really keen to receive papers, academic, practitioner. We want to see real world impact. So whether you're thinking about early ideas or refining work, want to present a case study or something, I think this conference will offer a really stimulating environment to do that. Beyond the formal program, which is shaping up to be really exciting, I think the conference will be amazing to have networking and building collaborations with colleagues and engaging with awesome discussion that hopefully will go well beyond the conference itself. So if the seminar today has sparked any sorts of questions or ideas or anything you want to explore further, I'd really encourage you to consider submitting a paper to the conference or just kind of joining us there for lots of fun and discussion. We would be absolutely delighted to welcome you to UWA. Finally, I'll just put I have a very unusual name. So if you just Google Ioana Evers, there's only one of me. So if you want to email me questions or connect on LinkedIn, please feel free. As Carol said, we'll be sharing the slides, so you'll have access to these after. But please do keep in touch. I can share anything that you're interested in. Thank you so much for your attention.
Fabulous, Ioana. That was absolutely great. So we're going to open up for questions. I just have a question about the role of social marketing. You mentioned in public health and the environment, but I'm interested to see how far it is reaching now into the social purpose sector in issues such as homelessness, in domestic violence and so on, where I haven't seen it so much. And in working with those organizations, I can see that there's a need for that upstream work because I've been involved in a number of advocacy campaigns that doesn't have a social marketer alongside us. and downstream campaigns in terms of behaviour change. And it'd be interesting to see how far we can go there, because I think there's a real need for social marketing to move across into that world.
Yeah, that's a really good question and comments. Because they, as you say, they are the broader big issues. There has been, domestic violence, for example, there are some really great social marketing initiatives happening that seem to be also longer term, both New Zealand, Australia. I can think of examples that, like, it's not okay. So those campaigns would be focused, I guess, on individuals. But then there's also some work then with interventions like towards like perpetrators, so people we know are abusive in the house, that it's not just kind of saying in a general sense, because those are like the campaigns are addressing norms. So, of course, even my parents' generation would say something along the lines of, if it happens behind closed doors, and I'm just like, no, I don't agree with that at all. Like, so the norm is changing. And so that's already midstream. Like, I think they're trying to go broader. But as you say, then it's also then about how we interact with like services and how we have governments committing to more funding or resources, broader than just a campaign to individuals. But yeah, it looks certainly in the last 10, 20 years, there is a shift more and more, like it's very strong in public health, but there is a more shift then going outside of those areas into other pressing, social issues.
Yeah, exactly. And I can see a question from Beck in terms of systems thinking, which, of course, is very prominent in the social purpose sector, and does lead us into the question of those upstream campaigns where we do need to see social marketers be involved in thinking through how one addresses those advocacy campaigns for policy change. Now, any other questions? I'll take one in terms of someone speaking. If someone does have a question, you've got some very heavy hitters in marketing, but also others. Shubham, if you unmute and ask your question.
All right. Thank you for that, Doctor. And thank you, Dr. Ioana, for the conference. Now, I want to continue on Dr. Paul's question. Now, in case, let's say there's a social campaign which is being aimed at domestic violence. So, in that case, who do you recommend it should be targeted and to make the most impact? I mean, when I talk about this, I'm looking at three entities. Either the people who are doing domestic violence, number two, the people who are being abused, and number three, the people who are surrounding these individuals. So whom do you think is it most likely to cause a habitual change and get some movement out of?
Thank you for that question, Shubham. That's a really good question. And I would say all of them, all of those distinct groups you mentioned are worthwhile of being a target segment. And as we mentioned earlier, each of those would have then different barriers or different behaviours in this way. So, of course, let's say you're targeting perpetrators of violence, the messages to them is, it's not okay. And that can be also more a norm setting in the culture, but also, stop perpetuating violence. To people who are being abused, then more about, it's not okay. You don't need to, it's so complicated. So I don't, it's hard for me to speak to this particular cause, but then this is where it goes more into systems, because it's not enough to say to women, okay, it's very gendered, but it is a gendered issue. The people who are being abused, just leave if there's nowhere for them to go. So that's where you then start having, there are places for them to go, a safe place at any moment for them to go. And before that there are places where they can get information easily. And so you can see even there's a lot of interesting and great work done in this field where if people are looking at information about leaving, they can easily a quick exit to get out of that in case the perpetrator sees that they're looking for help. Because I've heard about that a lot, that people can't even if they want to leave, maybe there's nowhere for them to go. So that's a whole thing, like that there is safe accommodation, safe place for, and not just one person, then for children or multiple people to go. But there's a way of finding that information safely. And yes, then when we start looking at this, it starts to exist at all the different layers of the system. It's not just leave abuse or stop abusing, or for people watching that situation or feeling like, oh, is someone I love in that situation, giving that person then the tools. What do they do? What would be, a way for them to help in that situation and not overstep or do the right thing? And yeah, so I think it should be, in terms of answering your question, they're very distinct target segments, and I think then the messages are different, and certainly then the support and the systems that are around each of those groups of people need to be properly addressed in an initiative over time.
Right. Actually, just talking about segments, I mean, in a critical realist perspective, it's what works for whom, when, and how. And so therefore you start to think of multiple segments and multiple exchanges, etc. Is modern technology able to run through these different channels now? I'm thinking, say, of the anti-gambling message that I see when I watch sport. I'm not into gambling, but I see these messages, and it just seems a single message. It doesn't seem to segment the audience. It doesn't seem to pick up necessarily on the different parts. How far have we gone to be able to do, real critical realist work in the social marketing area?
It's such a good question. The technology, I think, exists and is evolving to be better and better at allowing us to target. And I think, I'm interested then whether we're watching that on television, or it depends on the stream. So it depends like what channel and how we can target it well. So whether it's on social media, like billboards would be an example of, that's very broad brush. That's really like everyone's on the street, so that's not really targeted. But perhaps like on different social media platforms or on different websites or on very specific channels in which you can start to more and more target who is on that channel and therefore which message you want to give them. But I think as we go on more and more, we will be able to target with way more precision, because we'll be able to know about the people from the data that we'll have from their device or whatever, and then really give targeted messaging.
Yeah, fantastic. Any other question? Do we have another question out there in the audience? Just raise your hand. That's the easiest way. Nick?
Thanks, Paul. Thanks for the presentation. It was so good. I just have a super quick question. I was wondering about, I've seen some work in the misinformation space about the effects of like pre-bunking or inoculation, right? And how that changes over time, how you can give them a hit of some information from a really strategic message, but then it dies down and it dies down. And I'm just curious for your perspectives on the importance of repetition when it comes to social marketing campaigns, and whether that's something that matters as much or less or more so than some of the other things that we consider when creating that stuff. Thank you again.
Thanks, Nick. That's also a really great question. I think the evidence shows that repetition over time is important. And so that can really like embed whatever message that is over time. With misinformation, I think it's such a fascinating area in which we all have to be really like across, because we all have to be critical. And I guess in a general sense, how do people know what they're consuming or hearing or reading is correct or is accurate? So I guess as social marketers, the source that we are then like, who is saying it, who's our spokesperson, or from what channel, we want to always maintain credibility in the messages that we're sending. So if we're part of a government department or we're part of a not-for-profit, giving the messages from that credible source, I think there's a lot to be said for that, maintain that credibility, because of course, as we see across different kinds of social media or communications channels, then there's misinformation or less credible sources. So I feel like from our end, we can be really conscious about, ensuring that our sources or how we deliver or who we choose as spokespeople are very credible in, the perception of the target audience of them. But yeah, that whole misinformation, we could have a whole webinar on that.
Mm-hmm. Now we've got time for one quick response and then I'll finish up. But you can see in the chat a little comment from Jeroen. And I know you haven't been looking at it, but just a very, very quick response to that maybe requires a later email exchange. But do you have anything to say on his point about the distinction between social marketing and social behaviour change communication?
Yeah, I guess going back to the point that with this benchmark criteria, or what social marketers say is social marketing, it includes those criteria. And so with like a social behavior change communication, and I don't know that that theory inside out, but there is definitely overlap. But how we're using marketing ideas and strategies and techniques in a very systematic way. But yeah, I don't think exchange or understanding the competition is part of SBCC. But yeah, also then really knowing the product, price, place, because communication is obviously the promotion aspect, but those other marketing mix elements would also be distinctive of social marketing. But I would like to, I can get back to Jerome about like the distinction.
That topic. Good. Well, thanks so much. Now, Ioana, I can bet that this PowerPoint and talk will become quite viral in the future. That, you know, I think you've nailed the topic area, and it is a topic area which I can see has such enormous role to play, social marketing, and it's a role that has been so significant, I think, in health promotion. But I'm beginning to see more and more that in the broader social purpose sector, it needs to play a stronger role. So thank you so much. Now, Carol will be sending out to every person an email which says exactly where the PowerPoint will be and the video will be. So you'll get a message from us at some point in an email. But I'd just like to thank you, Ioana, for an absolutely brilliant presentation, and very practical and very insightful and thorough as well, comprehensive of the literature. So thank you so much. Good. Thank you.